Hello, my name is Dr. Jerome Ri. I am the owner of Upper Cervical Healthcare in Los Angeles, based in Carson, California, and I've been using digital patient chart EHR for about 3 years now. I recently took over the practice and I integrated the system into our practice, and I've noticed that this has worked better than previous systems. So I previously worked in an office where there was already a preset system that was more locally based and not cloud-based. So digital patient EHR is actually cloud-based, which means that you can actually access it through a browser. And what makes this so much better than some of the local-based types of systems is that when it's cloud-based, you don't need to worry about having like your own personal server and database and possibly things of that nature like data corruption or a failed server in which you would need to have either an IT person come out to take care of it or you'd have to try to deal with it yourself. So instead, having a cloud-based means that you can access this anywhere as well too. So there's a lot of really great features that I like about it. For instance, the use of AI tools to help generate reports, to help understand with diagnosis codes, and it's a very intuitive system too. And also, one of the best features about this is that it's very customizable. I've been able to manage to make it the way that I need it to be read so that I can take care of patients much more quickly and efficiently. That's definitely been a big plus in all this as well too. Also, this system also has an app both on iOS and Android so that patients themselves can handle scheduling as well as for themselves too. And that's something that is really important for me, is accessibility to patients. So not only can they schedule themselves, they can look at their own records, they can also chat with the doctors and the secretaries as well. So I think that having that accessibility feature is extremely important. So that way the patients know that they can somehow get a hold of the doctor as well too. Also, this system allows for really good built-in communication between both the doctors as well as the front desk staff. So if there is any questions about what needs to be done, both sides knows what to do and can take care of it very easily too. So it's also, because it's also cloud-based, it's very lightweight. In other words, like you don't need to worry about having like a massive system. You could use it on a very basic browser and still get all the features that you need. And another great thing about this is that it's constantly being updated. It's constantly being refined. And so all of the built-in features, not just the front, the front end, but also the back end, everything seems to work very fluidly. And I rarely have any issues with it whatsoever. And even if I do, the service involved in it to help fix these issues becomes very easy and apparent too. So for people who are looking for like a new system, this is something that I would definitely tell people to look into because, again, customizability, which allows you to make your system exactly the way you want it, is extremely important. Accessibility for both doctors, staff, and patients, again, very key, as well as the ability to have it both on web-based browsers as well as an app. All of these features all put together really make for a really great system for your office so that every single factor of this is taken care of. And so you can, like I said, it's for the ease of the doctors, ease of the staff, and ease of the patients. Everyone has a great time and easy time taking care of themselves too. So if you're on the fence and you're worried about looking into other systems, think about what all the other features are. I would definitely say that having a cloud-based system like this makes things much more simplified as well as robust, so that you can make this as robust and as thorough as you need it to be. So putting this all together, there's really no question on what type of system I think you should have. So if you have any questions about this, look up digital patient chart EHR and take a look for yourself.